Our speakers today are Sacha, Hollie and Melissa, who will be sharing their experiences on the CLEAR programme. And also Melissa will be joining us slightly later, hopefully when her section is about, so probably about 3:20. So yeah, over to you guys. And I think Sacha is first.
So, back one on the slide, sorry. There we go. So hi everyone. I've been asked to share my journey with 33N and my personal experience of undertaking the CLEAR programme. Firstly, I'll introduce myself and give a little background as to what led me here. My name is Sacha to my mum, and I've worked in the NHS for around 20 years now. I started as a support worker. I worked my way up to a senior practitioner within the crisis service. I enjoy being a nurse. Both my parents were brilliant nurses, so I had no choice, but this also meant I grew up with the values of the NHS and the dedication to help others instilled in me from a young age. Next slide, please. So where was I? As a nurse, my career had reached its zenith. However, I felt that there was more I could do, especially due to the frustrations that my colleagues and I had regarding service delivery. We would hear about changes on the horizon and we knew exactly why they wouldn't work, but we had no voice or forum to explain this. And it kind of reinforced the them against us belief between frontline staff and managers. We could also foresee problems or shortfalls in the service that needed to be addressed long before they were recognised by managers. But the sense of these concerns just falling on deaf ears led to indifference and low staff morale. Next slide, please. So what do I do now? I made the decision that I needed to take another step in my career, and it would need to be in service improvement. Using my experience to help my colleagues do their jobs, to regain their job satisfaction, and to continue to help patients by improving the care they receive. Unfortunately, my attempts to cross the divide were fruitless due to having no experience and no opportunity to gain experience. I would be unsuccessful in even securing an interview for any posts in service improvement. Next slide, please. Then came along the CLEAR programme, which seemed to be offering what I had been missing, both experience and training. I was put forward by my manager, who was aware of my choice of career direction. She recognised that this was ideal for me and was very supportive throughout the process. Within 2 weeks, I was on board and I started my 9-month journey to complete 2 service improvement and redesign projects for my trust. Next slide, please. So one of the main themes that resonated with me was the emphasis on involving practitioners in the improvement and redesign of the service that they work in. As I mentioned before, it'd be frustrating knowing what needed to change or what was not working and not being able to do anything about it. The CLEAR method gives a voice to the front line and gives you the responsibility to ensure that that voice is heard by those who can make the changes. Next slide, please. The programme was structured so you would learn about each stage of the CLEAR methodology and then complete it while working on a live project. The approach ensured that I was not overwhelmed by the vast scope of the project and the amount of work ahead, because I concentrated on each stage one at a time. Before I knew it, I was at the end of the first project and everything was there simply ready to be joined up and presented to the trust board. Along each step of the way, I was supported by some of the friendliest and approachable people I've ever met from every level of the company. I remember after a presentation, it was clear I was struggling a bit on workforce impact calculations, and help was offered from the very top of 33N. I didn't know at the time, but John started 33N, and I cringe remembering that I was teasing him for being a Chelsea fan before I knew who he actually was. Throughout the project, I've worked closely with other directors and managers in 33N who have made me feel I was in safe hands, and this helped me with my confidence and eagerness to do a good job. In comparison, until starting the CLEAR programme, I'd never met anyone above my direct manager in my trust. Next slide, please. As I mentioned, the programme breaks down service improvement projects into stages. First, we met up with practitioners from the service frontline and gathered as much as from them regarding what's working and what needs to change and any ideas they have. I enjoyed this stage because I was meeting fellow practitioners who were in the position I was in, and it was giving them an outlet to unload. I felt that due to being a fellow healthcare professional rather than a manager from the ivory tower, most tended to be quite open and eager to talk. I feel it was quite cathartic for them. For me, it felt like I was assessing a crisis patient at times, asking, prodding and poking questions to get a response, to find out what was going on. But the honesty that came through from the people who just wanted to be able to do their best to treat their patients made me determined to complete the project to the best of my ability. The next stage is data analysis, which is like Marmite. You either like it or you don't. Personally, I like it. Getting myself lost in the numbers, seeing what goes where and what affects what. It's kind of like being a detective. You have the narrative from the front line. So let's search within the data and find the proof to back up what the guys have told me. We were given access to a significant amount of data presented in very well-designed dashboards, which made the analysis so straightforward. I played for hours with the data, going down many rabbit holes before having to get back on track regarding what was relevant for my project. Then is the innovation stage. This was a bit tricky for me, but 33N, it gave us the tools and support from some very creative people to help us devise solutions. After each stage, we will present back to other groups that were completing projects for their own trusts. These sessions were valuable in bouncing ideas between us and using our shared experience. Also for me, this helped me build up my confidence in presenting. When I started this, I would have sleepless nights thinking about having to present to everyone. After a couple, it becomes quite straightforward, and that prepared me for the end of the project, where we had to present everything to my trust board. If you'd have told me at the beginning that I'd have to present it to my trust board, I would have walked away. Well, actually, I'd have run away, but I don't run because I'm built for comfort more than speed, as you would say. But as you can see now, I'm quite proficient at presenting. And I slept like a baby that night. However, the wife says I didn't snore like one. The final stage, this is recommendations, which is what the name suggests, is providing a plan of what needs to be done, when and how much it will cost to make the changes that were identified by clinicians that were backed up by the data. Like I said, it all flows and joins together neatly. So at the end, it just falls into place with no huge write-ups to do. It's just all there. Next slide, please. So as I mentioned, the CLARE program has helped me develop my confidence, especially around presenting, contributing in groups and meeting with senior management. It has also opened the door now for my next stage of my career, still continue to help others and ensure patients receive the best care possible. Since completing the CLARE program, I'm now working part-time with 33N, who are offering me further training, and I'm a site team lead for another project following the CLARE methodology with clinicians from another trust, as I was just less than a year ago. I'm hoping to continue to support staff from behind the scenes. However, wherever my career takes me, I will endeavour to seek the views of the frontline practitioners as a starting point for service improvement and redesign. Thanks.
That was great. Thank you, Sash. I won't call you Sacha. I'll leave it to your mum.
Sash, you're not my mum.
Do we have any questions before we go on to the next? Okay, that's cool. Thank you. Next up, I think we have Hollie.
Thank you. Yeah, hello. Okay, thanks, Sash, for that. So my name's Hollie. I'm a clinical lead in the Children and Young People's Urgent Support Team in Cheshire and Wirral Partnership, so CWP. So I've been in my role for about a year now. Prior to that, I was a care coordinator in a mental health team, working with people with psychosis. If you pop onto the next slide, I can just talk a bit about. Thank you. Yeah, so I've been in my current role for about a year. And the team that I'm in now is a new service, so it's a new crisis service in kind of response to COVID. So when COVID came in, NHS England told everyone that they needed a 24-hour crisis line. for each trust. So that was implemented quite quickly, and following that, a crisis team was then developed for children and young people to try and kind of meet all of the new standards that are coming in from NICE guidelines. So within my current role, it's both kind of clinical and operational. So I've been part of the development of the service and kind of like the behind the scenes type of work for that. So that's been really interesting. So I've always been quite interested in that side of things, but never really known how to get involved. So within my previous role, that was in quite a fairly new service as well. It was like 10 years old, so there was lots of developments within that. So I tried to get involved as much as I could, but never really knew kind of how to do it properly, really. So an email came around within our trust that talked about Clear, and I kept seeing it and I thought, oh, that sounds interesting, but I thought I'm rubbish at research, I'm not very good at numbers, and like I'll be rubbish at that. So I kept seeing it and I thought, oh, I'll express an interest and see where it goes. So so I had a chat with a couple of the clinicians within the trust that were kind of the sponsors, and they, you know, talked to me about it, and then I had a chat with Clear practitioners as well, and explain kind of the methodology, and that, you know, you don't necessarily have to be like really into research and numbers and all that type of stuff. And I thought, oh, okay. But when I started on the program, and we, you know, it kind of became apparent really quickly that actually you don't really need to be, you know, the best at research, and it's not really research as I thought it was. It, you know, the methodology is quite clear, excuse the pun, and the learning online, that's been really kind of easy to follow. Obviously Sacha went through like the methodology and the process that we've done now. So I'm currently working on a project for the trust, which is around transition, so children and young people transitioning over to adult services, and it's just been really interesting. So it's a kind of allowing us to be part of the discussions that are ongoing within the trust, and being part of kind of those behind the scenes type meetings. I've met lots of different practitioners within the current project, and that's allowed me to then get involved further with the transformation work that's going on in the trust, and how Claire's kind of helping inform that, and working alongside that. So that's been really interesting. If we move on to the next slide. Thank you. So yeah, so we are nearing the end of the project, and like Sacha mentioned before, I'm kind of feeling how Sacha probably felt when he did his project. So we're due to present to the trust board soon, and so that is a little bit nerve-wracking. So as it went well for Sacha, hopefully it'll go well for us as well. But yeah, so we're due to present our recommendations to the trust board, and we're currently writing a report at the moment in order to do that. And it's been really interesting to be able to kind of pull together all those clinical skills and put them into practice within the work that's ongoing in the trust, and hopefully improving the outcomes for the children and people that we're working with. I'm exploring as well within my own role how to implement the new skills. So there's lots of things that I wasn't really aware of before, such as kind of like workforce planning, you know, budgets, all of those kind of quantifiable aspects of service redesign that I didn't think I knew anything about, but now I do, thanks to kind of clearing the methodology. So that's kind of upcoming within our own team as that's expanding, and also thinking about kind of further training within my role. So I'm lucky that the sponsor within our trust is actually one of my senior managers, so I've kind of been able to reflect on the skills that I've learned in Clear, and talked about how that can be implemented in my role. So that's been really interesting. And then, like I said before, so there are ongoing groups within the trust that are working on transition, and they've kind of invited us to be part of that space, and continue on the discussions from the recommendations from our project. So overall, it's just, yeah, been really positive experience, and it's allowed me to kind of get to know lots of different aspects of the trust that I wouldn't have before. So yeah, that's me. Thank you. Any questions?
Yeah, any questions, feel free to put your hand up. Oh, we've got one from Stu.
Yeah.
Thank you. Hi, Hollie. My name's Stu. I've got an NHS background, and I'm going to be joining 33N shortly. So it's really nice to hear from people who've actually been involved in the programme as well, because I'm on a bit of a steep learning curve at the moment as well. So this is really useful. What would you say, having been on a Clear project, what are the two biggest sort of takeaways, or the two biggest pieces of learning that you've taken from that process?
Yeah, Yeah, so good luck with the upcoming projects. That's exciting. I suppose the two biggest things. So part of learning, kind of doing the Blackboard learning and the methodology of Clear. So I think it's helped me to understand how you can take those kind of innovative ideas and then actually put them into practice. So the logistics of it and the practicalities. I often used to have all these kind of ideas and think, gosh, that's really easy to implement, and that will be, you can do this and then it'll be in practice and that's fine. But actually, Clear's helped me kind of to understand the behind the scenes type work that goes on to put these things into place. So like the workforce redesign, being able to kind of quantify people's time and kind of in clinical work and putting that into like a plan then and presenting that to the trust. So it's allowed me to kind of get that behind the scenes information that I didn't necessarily have before, and be able to put that into practice to then present ideas a little bit more, with a bit more kind of oomph behind it, if that makes sense. So that's definitely one thing. And the second I would say is also kind of like the interpersonal type skills that I've learned as well. So throughout the programme we've kind of had sessions with like actors and to try and help us with presenting to key stakeholders within the trust, which I know Sash mentioned, like that's not something I'm really massively confident with, but now I do feel like much more confident to present to, and like doing this now, probably wouldn't have done that before I did Clear, but yeah, so kind of being able to present to people who will maybe challenge you or want kind of give constructive feedback. Kind of we've had sessions with people that have helped us reflect on that and reflect on our communication style and put that into practice. So they're two quite different things, but yeah, probably the two main things I've learned. Hope that made sense.
Excellent. Thanks, Hollie.
Yeah, thanks. Okay, thank you.
Any more questions? No, I think we're good. Thank you, Hollie. And hopefully the end of your project goes really well as well. Yeah, next up we have Melissa.
Hi, okay. Yeah, so I'm going to talk a little bit about my journey through Clear. I'm not sure what else I will be able to add because it's very similar to the people that have gone before me. However, I will begin. So currently I work as a complex care nurse in Hyde PCN. I've been in the role for about 3 years, and prior to that I was a district nurse in the same area. So I do know the area very well. However, I have to say I was very much, didn't really get involved with anything above what I was doing. It was kind of very much, you get caught up in the day to day and you just keep going, even though you know there are issues, you kind of just keep going. However, my manager suggested taking part in the Clear programme, and initially I was like, I can't do anything like that. I can't do it. And then actually I was very apprehensive, out of my comfort zone, having only had kind of clinical experience. However, I was keen to have a look at some of these issues, and obviously without something backing you up, you can't really make these changes. Also as well, I was finding that there's not a lot you can do when you don't have any time allocated. So I think that's another thing that's good about Clear, is the fact that you have your days set aside to kind of do the work, so you don't feel too overwhelmed, really. Because I think if you were trying to do something like that alongside full-time work, you would start to feel it. The methodology is extremely structured, and the supervisor support is always on hand, and the clinical supervisors are absolutely fantastic. They're free to speak to you whenever you need them. They're really reassuring, and you kind of, no matter what you're asking, you never feel like you shouldn't be asking it. They'll take the time to explain things to you. As I say, looking at quantitative and qualitative data was quite a new thing for me, and I have to say it's something that I did find quite challenging. But you do kind of find your way through it. Everything's a learning curve, but it does kind of give you the skills to present your findings, comprehensively, and they're very accessible to people as well. It encourages proactive practices and enables staff on the ground to make real differences. As I say, there's nobody better placed to know what's going on than the people that are working day in, day out on the shop floor, that are seeing what's happening, seeing what could be done better. You know, that's how our real difference is made. Also, you know, the opportunity to lead change and inspire proactive practice has been absolutely fantastic. I've actually found the more, you know, you're doing something like this, the more you speak to people about it, it kind of brings people in, and colleagues are like, oh, do you know, I wonder if I could do something about that side, that's not going great, or and it just kind of gets people talking and thinking more outside the box about ways we can work better with what we've got, because, you know, there's never much money going around for extras. If we can work the kind of, you know, with what we've already got, because a lot of the time what we've got is, it's a great resource, it's just, it's not always used in the right way. I have to say, obviously, soft skills, you know, communication with stakeholders. I'd not really done anything like that before. Again, I'd only really dealt with my manager, not really gone any higher than that. And I think I was a bit apprehensive about that. And I was like the gentleman before, lots of sleepless nights thinking, oh no, how am I going to do this tomorrow? But actually, because you're doing it week in, week out, same with the presentations. Again, I would have run a mile if anybody said, you know, you're going to have a presentation every other week. And I was kind of, you know, but when you're actually doing it, you find you get your rhythm a little bit, and you become a little bit more confident, because everybody is so friendly and it's a really non-judgmental space. You feel that, okay, if I'm doing my presentation and I mess it up a little bit, it's okay, nothing bad's going to happen, we just go back. And I think it's just that reassurance that you get as well. Obviously, teamwork has been a really big thing as well. Obviously, working as a nurse, I think you always work as part of the team generally. I think we are quite good at teamwork, but obviously it always helps to kind of build on that. And one thing that I would say as well is it's made me a little bit more open-minded when looking at solutions for the problems. You know, I think before you realise what's out there, you feel a little bit hemmed in with what you can do. But when you're given time to kind of analyse it and think, right, how's this working? What would really improve this patient care? Being given that time just makes you a little bit more open, a bit more creative about the way that you're going to deal with the problems. Hard skills, I have to say, there has been numerous really, really beneficial IT skills, and the software that you use with the dashboards and for the data analysis. When you first look at it, I remember looking at it thinking, I will never understand this. I do not understand. However, again, once you start getting into it, because you've got the time, you can really kind of just take a step back and go, right, well, look at this from the beginning, and it gives you permission and time to sit back from it and just really take your time. And obviously learning how to use the dashboards, you know, you are shown every step of the way how to do everything. You know, you're never left on your own. You're never going to be sat there thinking, I don't know what to do about this. And there is always somebody that you can contact. And even, you know, things like PowerPoint presentations, which luckily my colleague Emma I'm pretty convinced that she must do these in her spare time, because she's fantastic at them. I wasn't that great at them, but actually from us working together and with the people at Clear, you do kind of get used to putting your icons on and where things sit. And obviously if you need help with formatting and things like that, there is help from Clear. So that's been really beneficial. And what I would say is, with regards to leading change, due to the thorough, robust kind of evidence-based methodology, it really does help you lead change, because without that, as I was saying a little bit earlier on, you know, the more evidence we have, the better equipped we are to highlight the areas for improvement and development. And, you know, And due to the professional and informed presentation of the findings, clinicians can clearly see why change is needed. So you don't so much feel like you're trying to persuade somebody, because you don't need to, because the data speaks for itself, you know. So it's all based in evidence. And I think once completing the programme, I did definitely I found myself looking at jobs that I would never previously have looked at, because I always thought that was way out of my ability, out of my reach. You know, you kind of feel like if you're a nurse, you are on the shop floor, you do the job, you retire, that's it. And actually, you know, it kind of makes you realise how many other, you know, disciplines there are out there, and people that are really trying to make a difference. And it's just knowing that you're not kind of stuck where you are, and there's a lot of things that you can do that are going to make a real impact, you know, because sometimes I think when you're doing your job, you're turning up, you're firefighting, you're not being able to work proactively, everything's reactive. And I think that's when it takes its toll on clinicians, and when they end up kind of leaving a profession, because they just get that bogged down with it that you burn out and you've had enough. And I really feel like the programme, it kind of gives you confidence, it makes you believe in yourself a little bit more. You know, it's given me confidence to communicate with stakeholders, and also as well in the future, if, you know, whatever job I go into, if I leave the PCN, if I go somewhere else, you've got that knowledge base and that kind of template. So if there's anything that you're looking at in the future that you think, oh, this isn't working right, you can use that methodology, because you've still got it. You can remember it, you know, the way that you need to go about it, and how you collect the data, and how the importance of the qualitative and the quantitative. So I think, to be fair, I've missed out a lot of skills, and I'll go home tonight and think, oh, and that. But really, the take-home message is that it's really, really beneficial, both personally and professionally. So what I would say to clinicians, if you're thinking of doing the CLEAR project, but you're a little bit apprehensive and thinking, oh, I'm not sure that's for me, I would say have confidence in yourself, because if I can do it, you can do it. And there's loads of help out there. And also it's a lot of fun, and it's really rewarding when you come to the end of it and you think, wow, something that we came up with is actually being implemented, and it's got great feedback. And so, yeah, just go for it, enjoy it, and enjoy the 2 days out of your day job, because it's fantastic when you actually get to take a step back and think, right, what do we need to do? It's really, really rewarding. Any questions? No?
I think we have one from Caroline.
Oh, lovely.
I just had a quick question for all of you, really. I just wondered how taking part in the CLEAR programme, how easy was it for you to bring your colleagues on board, you know, considering how difficult it is in the NHS at this time? Were you able to, obviously I know you've all got a great deal out of CLEAR, but was it easy or hard to bring them along with you on the proposed
Do you want
change?
me to answer first? I'll go first. Yeah, so I think the only challenge is, as I said before, because the methodology is so robust, you kind of, the data itself gets the clinicians on board. But the one thing that I would say would be quite challenging that I found, at first they were kind of a bit apprehensive when it came to time, because it's, you know, well, how are you actually going to do your day job if you're doing this? But obviously, you know, there is secondments and things like that. So I think the only issue that we had in Hyde was getting people on board with us taking time out. But actually, once we got past that, they were quite easy to get on board, because the findings were well, it's evidence based, and you can't really argue with that, and that worked really well.
Yeah, I was just going to add to that. So in terms of like our scope was trust wide as well. So our trust is quite big. it's like obviously Cheshire and Wirral, but it goes from, there's like a really big geographical area between the whole trust. So we had to kind of like engage lots of people in the project. So it was quite easy really, because Claire kind of set up all the meetings in terms of like Teams meetings with clinicians for the actual like clinical engagement of it, and then people like attended those meetings. So we found that from the first meeting we explained things, and like Melissa said, because it's so robust, it's quite easy to follow. So then that engaged people a lot more. So the admin side of it was really helpful, because all the meetings were set up prior to us doing the project. And then the first meeting then just kind of got people on board that way, because it is quite clear and there's quite defined stages of the project. So yeah, we found our engagement was quite good. I suppose we're community and inpatient, and I think, like Melissa was saying, kind of the time for the inpatient services to engage with the project was limited due to like clinical pressure, but that wasn't something that anyone could control. But yeah, so I found it was quite okay to engage people.
Ash, how do you find it?
Sorry. In terms of engaging people, the second time we did it round with Hollie, we'd already set up the focus groups and everything. But when I did it, we actually had to set them up ourselves. But most people were quite eager to actually talk about what's going on and what needs to change in terms of clinician-wise. So it was, and especially again, because as I mentioned, being a clinician myself, I'd always introduce myself as a nurse first, because I see myself as a nurse first. So that was always get them on board, really, because they kind of saw you as one of them, one of us. So they kind of opened up really easy. So it was easy quite to get them on board and to get them to talk. Maybe I've just got that personality as well to get people to talk. I don't know, but that was quite straightforward. But in terms of the stakeholders and the actual trust itself, I think they were getting a free project. So being from up north, we're quite frugal like that. So a free project, and maybe as well, keeping me quiet out of the officer for a bit as well was probably helpful to them. But no, it was quite straightforward. I think Claire had done a lot of work beforehand in selling what was a clear methodology and what was happening, and so everyone was quite on board, really.
Lovely, thank you.
Thank you. Thanks, Caroline. Do we have any more questions, or are we good? Okay, cool. Thank you to our lovely speakers today, and thank you to everyone who's also attended today. We have sessions running to end of the week, so please do feel free to have a look at our website where you can just book a slot that you're interested in. Our next webinar will take place tomorrow, and that will be on tackling the backlog in elective care, where we'll deep dive into 2 clear case studies. So if you'd like to know more information, please do let the Clear team know or check our website for more. Thank you so much.